Good morning, everyone. Today is World Autism Day, and today I am here at Manovikas Kendra talking to our psychiatrist, senior psychiatrist, Dr. Sharada Sinha. Dr. Sinha, tell us something. Nowadays, we hear a lot about autism cases, we hear about autism spectrum. Is autism on the rise? No?
Well, we're certainly seeing more cases of autism, not everywhere, but we don't know whether really the number of cases are increasing or is it because of a broader diagnostic categorization, because now we call it Autism Spectrum Disorder. So a lot of the symptoms come into that. Secondly, when people are probably more aware and they come to us. Also, children are going to school very early nowadays, like 1+2. So, and their behavior can be caught by the teachers because, sometimes at home parents tend to ignore these things. But when you go to school and you see a lot of neurotypical children, then they stand out and the teachers say that your child has a problem. And the parents come to us. And also, of late, this is post-COVID, what is happening is we have seen a lot of very small kids, like in the age range, let's say 2 or 3 years old, who have been exposed to a lot of screen time during COVID because the parents were basically not able to go out, and they have all developed autistic-like symptoms. And whether we would call this Autism Spectrum Disorder or there is this Romanian psychologist who has named it virtual autism because he had taken up these kids and then he had put them for intensive special education sessions and he saw there was some improvement. So we don't know really whether, but of course we are seeing much more cases. The last study in India was done in 2021, 1 in 68. The figures in America, CDC says now is 1 in 36.
Wow.
So, need to be most prevalent studies.
So, Dr. Ghosha, what are the signs and symptoms of autism?
The common symptoms of autism include deficits in social communication and understanding others' emotion, poor eye contact, repetitive movements or behavior, a tendency to repeat phrases or words continuously, delayed development of speech and language, and sometimes speech variation, a difficulty in coping with changes or transitions, and unusual sensitivity to light, sound, touch, or smell. Now, how early can they be detected? It depends on how observant the parents are. The early signs and symptoms of autism can be detected in babies and toddlers as young as 12 to 18 months old. However, a formal diagnosis of autism usually occurs after 2 years of age.
How do we go about managing these symptoms? We have a diagnosis. You've given us some solutions. How do we now start managing it at home and at schools, maybe coming to special therapy? How do we go about it?
Yeah. So the management will again depend on the severity of the symptoms and also the age of the child. So while the child is very small, the child is going to be very hyperactive, because sensory sensitivities, as she has mentioned, is very common in very young children. So they will be all over the place and all. For these kids, we have to start with sensory integration therapy. Now, if they're a little bit older when they come to us, and it has been seen in the sensory sensitivities to some extent come down with age. I mean, not totally, but to some extent. So if you're a little bit older when they come to us, say whether it's 6 or 7 or 8 years old, then we will have to think about their cognitive development and we'll have to give more stress of special education. But in general, it has to be a combination of sensory integration therapy, special education, and also speech stimulation. But again, everything will depend on the severity of the symptoms and what is really predominant and what is really being a problem for the child. Also, the parents have to be a part of this because the children are coming for therapy for maybe 40 minutes or 50 minutes, or maybe they're in a special school for about 2 or 3 hours. But the rest of the day they are with the parents. So the parents have to understand this problem and they have to work on it. But like all the activities that they have to do have to be interesting and it has to be integrated in the day-to-day living skills. Then only the child will flourish.
And how about medication? I mean, are there medicines that help, or what do they do? There's always, when it comes to brain function and medication, we're always sort of in a grey area. Please tell us a little bit about it.
There is no medication to treat the core symptoms of autism, but we prescribe some medications to treat some target symptoms like hyperactivity, stereotyped behavior, aggressive or self-injurious behavior, especially when these are not adequately controlled by psychosocial interventions and causing distress to the child and the family.
So, you mentioned hyperactivity. Is autism or are autism spectrum disorders always associated with ADHD or any kind of hyperactivity? How do we differentiate between ADHD and ASD?
Yeah. So autism spectrum, so in the DSM-5, we have been allowed to diagnose autism spectrum disorder with ADHD. Previously, we had to say whether there were two different entities. But it has been seen that genetically they are kind of related. So there are a lot of children who will be on the autism spectrum disorder, but they may have traits of attention deficit disorder. And there will be children who are attention deficit disorder and have attention deficit disorder. But the main thing is the children on the autism spectrum disorder, they will be showing social communication deficits. They may be very hyperactive, but a child who is ADHD, the parents will not tell you that. The parent may say that when I call the child, he looks at me and then he looks away. And the same thing is what the child with ADHD will say, the parents will say. But the child who is on the ADHD spectrum, the parents will tell you that the eye contact was never good. But this ADHD guy will just look and he look away. So these are very tricky places that you have to take a good history. You have to observe the child, but yes, sometimes ADHD is associated with ADHD, but the thing is that we have seen that for attention deficit disorder we have to give medications. For ASD with attention deficit disorder, sometimes these children do not react well to the stimulants we give. And then we have to see if other, other modalities of therapies work. But the thing is, what we have to understand is, frequently parents come to us and say, my child is ADHD. Okay, so ADHD is a diagnosis which is more culturally acceptable than an ASD, because ASD means it is lifelong, and ADHD they think probably it is only during the developmental period when they grow up. But now we say that ADHD, the adults also have ADHD. So this is a fine line, and the clinician has to be very careful about how to go about treating it and how to go about explaining. But the best thing is to take the symptoms that are causing most problem, and then tackling it.
So then can children with autism go to schools, normal schools, preschools?
Yeah, that's a little bit of a question. Because it depends a lot on the schools, So nowadays there are a lot of play schools who are very supportive and the various, so probably in those kind of schools, the young kids can go to very small and they are by 1 and up to 2. But if they're very disruptive, if they're on the lower end of the spectrum and they're very disruptive, then it may be a little bit difficult. But if the school is a little bit tolerant, maybe yes. And about schools, in the primary or in the secondary sections, then it of course depends on how supportive the school is, the school strategy is, how supportive the teachers are, and whether they are willing to keep a child who's going to be a little bit disruptive, but they have to give more attention to the kid. Maybe make him sit in front, maybe understand his sensitivities. So it depends a lot on the school, but also one thing that parents can do is that they can prime the child for the following, and especially with pictures, because the autistic children understand pictures better than words. So you've got to go to school, you've got to sit like this, and when the teacher tells you something, you have to be. It is a tedious process, and there has to be cooperation between the parents and the teachers. So the teacher, the counselor can, sometimes in certain cases just runs out of the class, and then we realize it was because of the pigeons. The pigeons used to make a noise like the child has sensory problem. He could not take that noise, and so he would do it. And they understood, and they were a bit supportive about it. So it depends on skill. It depends a lot on the school, I think.
So personalized education and inclusive education is the real answer.
Yes.
To hit our problems. So one final question, I think this is a question all parents have. Is it curable? Is autism spectrum disorder curable in you grow out?
Autism spectrum disorder is not a disease. It's a developmental condition. So it is not expected to be cured. But it can be managed with proper interventions, especially if the condition is diagnosed early in the childhood. A person who has autism spectrum disorder may continue to have some residual skill defects throughout his life, depending on the severity of the condition. Some may require some may have very mild social challenges, whereas the others will require more support. However, in spite of all this, with proper support and resources and care, an individual will be able to achieve his goal and contribute meaningfully to the society.